Well, I mean, the fact that there aren't that many caregivers available, I think that is the challenge that these providers have. These people come, show up for a day or two, or maybe a week, or maybe even a month, and they leave, and they are left without any help. So I think there's a big scarcity of caregivers in general.
The direct care workforce and how hard it is to find them is going to be the key issue that, as I said, will affect the productivity and the economic success of America. It is as big as that, but it's also as small as how is anybody going to be able to work if there's no one to care for a patient, their mother, their sibling, their spouse who needs care.
When it's short like that, it should be mandatory that nursing homes have an agency on a standby to call somebody in, because that workload is not heavy. Because some of them rely on staff, and you already knew that 2 people wasn't coming in.
When you say, when you say you knew, you're referring to your employers?
Yes, they knew. Someone called out, you knew it was going to be short. Y'all knew y'all couldn't get it covered. You think you covered until you get in there, and then you find out, Tariq called out 2 hours ago, and we couldn't find nobody. It's hard, and it's really hard. And then being short staffed, taking care of all of them, and then your pay ain't about nothing.
We getting $12 an hour. We get injured. We get spat on sometimes. We get scratched, and we go home with no health. You know, there's nothing for us to go to the doctors and heal. So we're out of work trying to heal because of an injury we got with a client.
I would say the pay rate, the supplies, just general things that are lacking every day in the world.
Okay, so more, I guess, financial support is always helpful.
Yeah. Better insurance, better everything.
Maryland does not know how many home care workers there are because the agencies are scattered and they're doing their own thing. So that's why we're not getting benefits, because there's no one overseeing RSAs. And so I spoke in Annapolis and I told them we need a database. We need something to bring these agencies under an umbrella of the Maryland Health Department, Department of Labor, RSAs, and Department of Aging.
I just wish that they would have something to help the families, because now we're going to be screwed. Like, there's 2 cars. Oh, now all the state gets it. I need help. I ain't got paid in like 2 years. And now like the state just takes it all. And it's like, I'm just kind of screwed here. So I wish there was something in the legislation where a family wouldn't lose everything,
You shouldn't have to sell everything you own in your family and not leave a legacy or inheritance to take care of a family member. That's just inhumane. I'm part of the Venti Circle. There's so many women in there that can't work, or if we're working, we're burning the candle at both ends. Imagine if I was married and have children. We're talking about Superwoman. Well, then you definitely need some counseling. Can you give a sister a gift card for a massage on a regular basis?
Sometimes it's not just the nursing visit, but also support for the caregiver needs to be included more in that payment schedule. For someone to come in, even if it's just to sit so they can go to the grocery store, walk in the park, that these are all important things. The support groups, support services where caregiver can talk to other caregiver. We are saving the health services a lot of money, and pitching in that little bit for those types of services is going to keep them out of assisted living or higher levels of care forever or longer. Help that family stay in their home and caring for the one they love.
Not everybody wants to be a direct care workforce individual. We have to honor them and all that they do for the American society, the American workforce. It is one of the biggest policy issues facing our nation